Dear sirs, I would like to thank you for giving us the chance to present our study in the ARDTA Congress this year. Title of our study is Hemoperfusion Hemodialysis patients with COVID-19 infection, impact on clinical course of our patients. Our nephrology department in Athens, Greece, during spring period, during the first wave of COVID-19, was the referral dialysis unit for COVID-19 positive hemodialysis patients. We use hemoperfusion as a therapeutic option in our patients. The aims of this study are to report characteristics, rates, and outcomes of all patients affected by infection with COVID-19 undergoing hemodialysis and were treated under our care, focuses on the impact that hemoperfusion had on them. Actually, this is an observation study. Our patients divided in two groups. The first one had the patients that underwent hemodialysis sessions with hemoperfusion, and the second one had the patients that received hemodialysis sessions without any kind of extracorporeal blood purification method. We used recent direct hemodialysation cartridges 330 and 130, manufactured by the Jafran Biomedical Company in China. We registered all the data regarding the clinical course of our patients, including age, primary cause of end-stage renal disease, weight, clinical presentation, hemodialysis history, outcome, and days of hospitalization. What we actually saw in the group 1, we had 12 patients that received hemoperfusion for 3 hours in our dialysis unit and 1 that received hemoperfusion in ICU. From the 13 patients, 5 of them were presented as asymptomatic at admission and 7 of them admitted with or developed during their stay pleural infusions. 4 of them were asymptomatic without infusion during the whole hospital stay. We had 6 patients that had 1 session with hemoperfusion and 6 patients that had 2 sessions. The patients that admitted in ICU started hemoperfusion the 3rd day of her admission, and the pattern was as follows. The cartridge of 330 in the 3 consecutive days at the beginning. In day 10 we used 130, and in day 13 330 again. Hemoperfusion was performed in all of our patients for 3 hours. 24 days was the average hospitalization stay before starting hemoperfusion for the 12 patients in ports. 9 patients discharged from the hospital after 43 days of hospitalization, and the 30 days were the mean hospitalization stay for the deceased ones. We don't observe any kind of side effects regarding the methods such as hypotension, reduction of platelets, or bleeding. 9 patients was in the group B. All of them were presented symptomatic, and the outcome was much more worse than the group A. To sum up, hemoperfusion seems to be a helpful, safe, and quite efficient tool in the battle against COVID-19 hemodialysis patients. Despite the method is unspecific, our lack of strong evidence, our views are with the opinion that it's a reliable alternative therapy. However, the real impact of hemoperfusion on the patient's clinical course, time of initiation, therapeutic protocols, tools to evaluate response has yet to be determined. The above notice though does not minimize the great interest for the method that renal community should give on hemoperfusion. Thank you very much for your attention.